When a new innovation comes, we all get excited and talk about it. And if it is related to the health, particularly in the cardiovascular related, that really steals all my attention. One of those type of innovation going on right now is a biodegradable graft, which will be used to replace the blocked or damaged arteries to combat the cardiovascular disease, which is the leading cause of death worldwide. This biodegradable graft is tough, stretchy straw. It is not only expand and contracts like the vein or arteries as the blood pumps through it, it also absorbs into the body as new cells grow in and around it and take their own place. So even though this artificial graft will be placed, eventually the body will grow new vascular cells and the artificial graft will be degrade and go away by itself. The problem with the graft currently used is the material used to repair cardiovascular structure have basically remained the same since 1960s. The current technology is good enough for certain application, but it is definitely not good for all. When a person has a blocked artery, the first option is to implant a stent, which is angioplasty, or to take a vein or artery from the leg and use it to replace the clogged one, which is bypass, or CABG, which is coronary artery bypass graft. That comes with its own problem. When needed an emergency bypass during heart surgery, doctor had to very quickly cut open his leg and take out a vein to use it for the graft. The leg always doesn't heal and limiting the blood flow, which has a long-term effect. And if that happens to a diabetic or an old person, that could be much worse. If a graft from the patient is unavailable, surgeon has to insert a artificial graft like a hollow wire made of Teflon. The same material is used to coat the non-stick pan or waterproof jacket. And these grafts are very stiff compared to the arteries, and the mismatch creates a lot of problems. So what happens at the junction between the stiff graft and the soft tube, the arteries? It creates a lot of tension there, which cause inflammation and scarring over time. So it closes down again. That's why graft fail about 20 to 70% of the time, depending on the location of the implant. Moreover, grafts don't work well in the area where arteries are smaller than 5 mm in diameter, like below the knee. You hear about the diabetics getting their feet amputated. That because there are no good option to bypass below the knee, where the arteries are smaller than 5 mm in diameter. Now this biodegradable graft, structurally this material is metalloelastomer, a polymer that is similar to the natural rubber, and composed of molecules that behave like random coils. When the elastomer is exposed to metal ions, the random coils bind together. The elastomer then behave like three-dimensional fishing net and mimic the natural elasticity of arteries or veins. The material, the elastomer, springs back into the shape after it is stretched, but it is also very strong. You literally cannot break it. You can pull on it, it will expand, but the minute the force goes away, it will go back to the original shape because it is tied down by these knots. Not only does this material expand and contract as the blood flow through it, it also degrades in about 12 months as the new blood vessels regenerate in its place. So we don't have to worry about the foreign material staying in the body forever, which cause inflammation, cause a risk of thrombus, clot formation, causing this mechanical mismatch that cause all these problems. This is still being prepared for the trial and may need a few more years to apply to the general population. But once it is available, it will definitely change the dynamics and revolutionize the cardiovascular treatment. It can apply to the arteries that are less than 5 mm in diameter. No need to extract vein from the leg for the bypass. Replacing the arteries or the aorta with this material instead of the Decon aortic graft. It can be custom made for the specific need, and the best part is that it is biodegradable, which will resolve itself in a year and the body will regenerate the vascular cells to grow in and around it. This would be revolutionary and will give hope to many patients in future who otherwise won't have it.